We've all heard our gut is our second brain, but this episode gives us so much insights onto how and why that is. In this episode, Dr. Z educates us on the importance of getting the full picture of a patient's concussion history and brain health, and how that can really affect our entire body system. And not only that, but how can we change our environment to promote healing when we're dealing with compromised brain health?
So true, Melissa. And I really appreciated that this episode was a nice blend of science, research, and hot topics, all delivered with a really contagious, sunny personality that Dr. Z possesses. You won't want to miss this one. It really is jam-packed with clinical pearls. And in fact, after recording this episode, I'm sold on adding a vibrational plate to my wellness routine. So let's get started. Hello and welcome back to the Vibrant Wellness Podcast. I'm your host, Dr. Emmy Brown, here with my always vibrant co-host, Melissa Gentile. Today, we're excited to have Dr. Henry Zaremba, a dynamic force in the realm of brain health. Dr. Zaremba, affectionately known as Dr. Z, is a board-certified chiropractic neurologist at Apex Brain Centers, where he specializes in harnessing the brain's innate capacity for healing and optimization. Dr. Z brings a wealth of knowledge and experience in treating conditions ranging from traumatic brain injuries to cognitive decline. His passion for brain health is not just professional, but also personal, having been sparked by his own experiences as a collegiate athlete dealing with concussions. Tune in as we dive into Dr. Z's innovative approaches to brain rehabilitation and peak performance. We'll also touch on the relationship between the gut microbiome and neuroinflammation and the latest advancements in functional neurology. You won't want to miss this one. Dr. Z, welcome. We're so glad to have you. How are you doing?
I'm doing well. I'm over the moon, actually. I've been a fan of your podcast since day one. You know, when I saw that Vibrant was coming out with a podcast after having used their services for a period of time, it was like, wow, this is cool, and you guys have delivered. Yes, I'm very happy to be here recording with you guys today.
Awesome. And thank you so much for that. We love doing it, and we love having providers on like yourself. Before we jump into the nitty gritty, you've dealt with severe concussion in the past. You were playing collegiate hockey. And so that's something that seems to be very inspiring. And I'm wondering, were you studying medicine before that experience, Dr. Z? And if not, what were you looking to study, and what was your career of choice before that?
Sure. So before that, when I first started college, I played hockey since the time I was like 4. Like it was just kind of my bag, you know.
Very cool.
And I always was just one of those kind of, you know, definitely a nerd, but also liked to think of myself as a jock a little bit too, and just loved sports.
Well-rounded.
Yeah, right. Yeah, thank you. I always was thinking, you know, I wanted to be interested. I wanted to work with athletes and, you know, just do something to just be involved with sports, you know, as my job. And I think I was thinking more medically oriented around the lines of being like an athletic trainer, physical therapist, you know, and just, you know, something on those lines, maybe being a sideline trainer or something like that. So for that at UNC Chapel Hill, where I went to my undergrad studies, the major for most people is exercise and sports science is what that's called. And there's subshoots there, like you can major in like sports administration and things like that. But I did kind of the athletic training track. So a lot more focused on just how the body moves, biomechanics, which I found to be super fascinating, especially as I was learning more about it. And that was ultimately, you know, my path until senior year when I suffered a concussion that just affected me on a deeper level. You know, it definitely wasn't my first concussion, but it was much more far-reaching than the things that you think of, like the headache and light sensitivity and things like that. I started dealing with some depression, you know, pretty severe depression. My college lifestyle that I was living probably didn't set the best foundation, or kind of, you know, I think like laid the TNT out there, and then the concussion probably kind of sent me over the edge in a lot of ways. That was just kind of a real shakeup. You know, I had to pull out of classes, you know, also just the way it was affecting my moods. You know, I was Mr. Happy-go-lucky beforehand, but it just was making me, the depression was making me like argue with people. Like I broke up with my girlfriend at the time. I wasn't on good terms with some of my roommates. Like, it was just a really stressful time. And with all the time on my hands, kind of not going to class and things, I just started doing some reading on the internet about concussions. This was right around the time the movie Concussion came out, with Will Smith was the actor portraying Dr. Omalu, who was a neuroscientist who basically was talking to the NFL around, the damage he was seeing in players. You may have heard the term chronic traumatic encephalopathy, or CTE. So that was very much in the headlines around the time that I was going through this, which then lent itself to all these athletes kind of wanting to share their stories about the head injuries they've overcome and kind of what they've done to get back on the field or the ice or the court. So the Players Tribune actually was kind of instrumental for me. It's a online, think like Sports Illustrated, but all the articles are written by the athletes themselves. So Sidney Crosby, a fairly prominent hockey player, he's still, one of the best hockey players in the league. At that time, had 2 concussions really close together and basically had to miss a full season, in his prime. He was early or mid 20s at that point, and we're talking about one of the best hockey players in the world. And basically, it was his career might be over at this point. They weren't sure if they could bring him back. And Dr. Ted Carrick, who a lot of people credit as sort of the founder of functional neurology, was the one that basically saved his career, and he very much credits him for that. So that's kind of, a bit of a long-winded story, but a little bit of how I kind of got to be where I am today. It really all started when my head got hit. So now I try to help other people kind of put things back together.
And do you think that concussions were overlooked kind of before that time, before those headlines came out?
Absolutely. I mean, it was the kind of thing where there just wasn't any sort of attention around it at all, and now it's much more in the headlines. But, especially, that whole movie, Concussion with Will Smith, was all about how Dr. Omalu, and this was based on a true story, was seeing all these aggressive incidents, changes to neuropsychology, emotional management, behavior, self-regulation that he was seeing in these football players. And then an autopsy was seeing severe damage to their brains. A lot of these players, especially, as kind of more and more of them were going through this, were actually killing themselves by shooting themselves in the heart and leaving suicide notes saying, someone needs to study my brain because I'm going through this. Now, it wasn't a totally new concept at the time. Dementia pugnilistica, which I'm maybe not getting that Latin exactly right, but it's basically the name for fighters' dementia, or, boxers' dementia, with boxing being a very prominent sport in kind of the early part of the century. That was pretty well documented, but the CTE just seemed to be a whole new animal.
Oh gosh, yeah. It's so shocking to kind of think about it in that way as far as behavioral change. And I'm wondering, Dr. Z, did you feel like I don't recognize myself when you were struggling with that and you felt like you needed to dig deeper?
Yeah, there's elements of that. The age that I was, being a senior and kind of on the precipice of graduating and all those things, that can be disruptive to kind of yourself as well. So, I'm sure that even just thinking of the timing of things, right? There's not like an ideal time to get a concussion, but the timing of it just kind of magnified, I guess, its effects, if that makes sense.
Sure, yeah. And I'm wondering, were you seeing a conventional provider at that time? Were you seeing anybody before you started to do your own research?
Yeah, at that time, I was getting care through the Stallings Evans Sports Medicine Center, which is the on-campus treatment center. As an athlete at UNC, that was something that was free for me. So I was going there pretty regularly, doing some kind of basic exercises. I actually got really lucky in hindsight, because kind of after talking with some of the interns and people that I was working with there, they ended up finding another student intern who was really fascinated in concussion rehabilitation. And they did a lot. I ended up working with them primarily in, UNC, University of Pittsburgh. There's certain colleges that have just had these great contributions to the literature when it comes to the brain and concussion. And luckily I was at one of those universities, and I did receive, good treatment. It's the kind of thing where I can think back and analyze and think things I would do differently. But, compared to the kind of status quo or, kind of standard of care at the time, I feel like I really lucked out.
Yeah, especially being at a university where you have so many brilliant minds, and it's interesting how sometimes it feels like the universe is conspiring to help us out here and there. At least I like to think
Yeah.
so. That's cool. Thank you
Yeah,
for sharing that.
totally. Yeah. Oh, of course,
And
of
Dr.
course.
Z, I do want to get into gut microbiome and its impact on health overall. We kind of hear this term that the gut is the second brain, but I want to dive into it from a brain health perspective. So, kind of
Mhm.
backtracking here, what are some neurological symptoms or signs that you can see when our gut is imbalanced? Because when we think of an imbalanced microbiome or an imbalanced gut, we think digestive upset, maybe some skin issues, but what are some like brain symptoms that people can be experiencing?
Sure. So, in terms of symptoms, especially when we talk about intestinal dysbiosis, one of the things that we commonly see is things like brain fog. Most patients who come to our center have had some sort of brain injury or, documented learning and behavioral disorder. Also we work with neurodegenerative disorders too. So, a lot of people, their symptoms are being that come to our office, their symptoms are being driven by the brain injury, but changes to the microbiome are absolutely part of that. There are some good studies now
Oh, okay.
showing that within seconds of a head injury, we get changes to the gut lining, which is going to change kind of
Wow.
global
Mm.
inflammation in the body, and the brain is not immune from that. We have the blood-brain barrier, and it certainly does work differently than other parts of the brain. Yeah, the intestinal dysbiosis can absolutely have effects on behavior, cognition, memory. There's some really great studies, especially in mice, looking at the gut as basically the origin of Parkinson's disease. And what they found was that when they cut the vagus nerve in these mice, the mice that had their vagus nerve cut didn't develop Parkinson's. So that led to this hypothesis of maybe the infection or changes to the microbiome state are leading to alterations in the vagus nerve signaling, which is then leading to these plaques assembling in the brain and kind of continuing that progression and breakdown in movement and tremors and things along those lines. But one of the things that we do a lot in our office is doing that gut microbiome testing for people that have had concussions and brain injuries. Because when we're trying to heal what's going on up here, we need to optimize what's happening in the gut. Otherwise, we're fighting this uphill battle the entire time. Something like 90% of the serotonin, which is a really important neurotransmitter for our moods and behavior, is produced in the gut.
I was
And it
just going
works.
to ask that with neurotransmitter production in the gut. Yeah.
No, super important. And then not to mention just systemic levels of inflammation. For example, with
Mhm.
people who have type 2 diabetes or any diabetes for that matter, there's a lot of studies showing that they're predisposed for a lot of different types of brain disorders and brain dysfunction. There's even the type 3 diabetes that you hear nowadays, which is basically uncontrolled blood sugar leading to dementia and Alzheimer's disease. But one of the things is you can think of the microbiome as basically this big switch that helps to control how the body is dealing with inflammation because of how it can kind of turn on or off our different macrophages. There's what's called M1 state, where a macrophage is in the periphery and it's in a pro-inflammatory state. And it kind of produces pro-inflammatory cytokine signaling. And research has shown that then the M2 macrophages actually are anti-inflammatory. So they're in the cell at that point, kind of having different functions. So yeah, the microbiome is for pretty much any brain-based disorder is a go-to to A, evaluate, and B, try to create a better environment so that the microbiome can serve the brain instead of taking away from it.
I mean, that's a
Well said.
lot. Yeah, that's a lot to unpack. I was really thinking the gut microbiome as the origin of some, brain conditions, but I didn't even really think about like, okay, traumatic brain injury can actually have almost like a downstream effect on the gut. So that's really interesting. And what are some of
Wow.
those? Yeah, what are some of those first steps that you take to improve the gut microbiome? Like, I know it's probably going to be different patient to patient, but do you have a general protocol, different phases that you take people through? Where do you start?
Sure. So with a lot of our patients, we'll start them on some supplementation pretty early on, even before we get lab testing back as metabolic support. Our office primarily works through immersive treatment programs. So patients are in the office for 4 to 5 hours a day doing repetitive brain therapies, both, active and passive.
4 to 5 hours. Wow.
Yeah, it sounds like a lot, especially for someone with, a concussion or something, and they can't even, think for 2 seconds, let alone that long over the course of the day. So we always try to meet people where they're at. But we use a lot of products through Zymogen. They have this product called OptiCleanse GHI, which is a fantastic medical food that we use with a lot of our patients. I've even had patients use it in their feeding tubes, and we could have a whole other episode on the things that are putting in people's feeding tubes in hospitals today. But the OptiCleanse GHI is a fantastic product, and a lot of our patients are on it because of that inflammation modulation, like we talked about, and its effects on the brain. Not to mention having access to energy. Everything that we're talking about the brain and the microbiome, I think an important thing to kind of establish is how sensitive and picky our brain cells are and our neurons are compared to other cells of the body. So kind of an example of why that's important. The brain's about 2% of the mass of the body in terms of like grams, but in terms of energy consumption, it's about 20%. And that's for the average person on the average day. And on top of that, our neurons don't have any backup energy. So like our muscle cells, we have glycogen stores. We have different metabolic pathways that kind of turn on and off as we are running a race or doing an exercise, and we're breaking those fibers down, burning through the initial energy source. There's a backup. I always explain it to patients like that energy bar you keep in your purse or your car, like it's there. You've got some sort of fuel. Our neurons are totally reliant on a steady flow of blood sugar from the periphery. That's why levels of inflammation are going to affect the way that we have insulin getting that glucose into the cell, which is going to have a massive effect on brain behavior.
I do have to ask, just because you brought this up about blood sugar and how that's, the primary source of energy for these neurons, is what about people on a ketogenic diet? And like, why do their minds feel so sharp when they're on that? Do you advise against that? Ketones in the brain, what do you think?
Sure. So, true ketosis, kind of being 100% ketosis mode in your body isn't something that a lot of people can achieve. It's really difficult to achieve. But low carb diets, we talk to people about all the time. There's different levels. We get the person that comes in that's been doing all these research and found a website and is like, well, I'm doing keto, and then I ask them what they're eating, and they're, eating tons of like low quality butter, or they're drinking milk creamer to get more fat calories. And there's just this misunderstanding, right, exactly, of how to truly do it. But quality fat consumption is hugely important. We talk to a lot of our patients about it. And oftentimes we try to talk to them about burning fat for energy instead of carbs. So yeah, definitely want to promote that ketosis as much as possible. And we find that a lot of our patients do feel better on that. But it depends. Some patients just kind of do need that carbohydrate input, just to kind of feel more stable, just the way that their metabolism is set up. But you can think of it like burning fuel. When we're burning glucose, it's a dirtier fuel than if we're burning fat. Like hopefully people listening to this are aware of the crisis on our planet right now, and emissions and things like that. And there's all these clean energy sources that are investigated, things like solar and wind and things like that, as opposed to things like coal and gasoline, which have these byproducts. And that's what you can think of with carbohydrate metabolism, is that the byproducts, the oxidative stress that's a result of that carb metabolism, is going to have detrimental effects. As much as we need that energy, if we can get it from somewhere else by, say, breaking down lipids, that's going to provide more energy per molecule in terms of ATP, but also it's just cleaner burning. There's less of that fluctuation in our insulin levels. If insulin levels are more stable, the brain tends to be more happy because the fuel supply is more steady, as opposed to kind of going up and down and then up and down. The brain is happier when it's able to kind of draw from the blood when it needs, as opposed to having to kind of maximize what it's doing at certain times and then kind of having shutdowns at different times.
That's hugely helpful to paint it that way, Dr. Z, in terms of the oxidative stress that you get from the refined carbohydrate and carbohydrate fuel in general, and the metabolic piece. I think about carbs as being like kindling. It's good to set the fire, but it doesn't stay burning for very long. Whereas that big wooden log, that's going to be the fat. for example, that stays burning and sustains you for a lot longer. So thank you for painting that picture in that way. I think that's hugely helpful to understand why fats are more helpful for functioning overall.
100%. And, so many patients are just so broken from that food pyramid from, 20, 30 years ago with the all the grains at the 6 to 12 servings a day. And that's haunts us.
Totally. Well, and it's so confusing to kind of make sense of all the conflicting information still that you see put out social media from so many different professionals also. But I'd love to jump into, you brought up testing just a moment ago. I'm wondering if you've noticed any patterns on the testing that you do, whether we're looking at post-concussion syndrome, for example, or cognitive decline. What kinds of patterns, if any, are you noticing on functional medicine testing for those folks?
Sure. So, quick question. Across the board, one of the things that we're seeing with so many of our patients, even patients who maybe aren't coming in with a ton of complaints, but, are just looking at brain wellness, is diversity in the gut. And there's some great studies showing that the higher diversity in the microbiome, typically that means it's healthier. Not even getting into good versus bad bacteria. So we see that looking at the Shannon's index, the Simpson's index, typically they're low across the board, whether we're talking about a concussion, someone with cognitive decline, post-COVID neurological syndrome, which is something that's, we found a lot of patients in our office are suffering from aspects of that. So that's a big pattern that we see, and literally looking at the gut zoomer interpretation, it's like first thing on the first page, like right there, we already can get some really good information. One of the other things that we are frequently seeing with patients here is the inflammatory markers and also elevated fecal zonulin for concussion patients, especially post-concussion syndrome. Right now, the literature and the statistics basically predict that about 50% of concussions are going to be fine on their own. But it's the other 50%, that really need our help and need our services. And so many of those people deal with long-term effects without that ever being fully addressed. So oftentimes when we look at these people where you were in a car accident a year ago and you still can't, remember people's faces or can't read on a computer or whatever the complaint may be, oftentimes we're finding that those inflammatory markers are elevated, and then that fecal zonulin is also elevated. And the zonulin is really important because when we have leaky gut and proteins from our foods start to leak into regular circulation, it's going to throw off the immune system. The immune system is highly important for the brain when we talk about the blood-brain barrier and what's able to pass through or what isn't able to pass through. When we see elevated fecal zonulin, we can order a neural zoomer test. A lot of times I'll tell a patient, we should wait to order this neural zoomer test until we go through some treatment, because right now you're going to have all these immunoglobulins in your brain that are reacting to things that are coming from the gut, so that's where think smarter instead of just kind of shotgun approach. The gut zoomer is just so foundational for a lot of things that we do, and then helps lead to other testing in time. But that fecal zonulin with head impacts is something that half the time I'm just like, yeah, zonulin's going to be on there, put it on the report, and then I'll take it off if it's not.
And when it comes to treatment, before we dive into more innovative neurology treatments, like what's something that you see other practitioners in this space missing when it comes to treatment?
So with that, it kind of lends itself well to what I said before about kind of further testing. The hormone testing, urinary hormones, salivary hormones can shed huge light on how the brain is functioning. If you think about it, as women are typically more estrogen dominant, estrogen plays a big role in lipid metabolism and sort of, adiposity or fat levels all over the body. And the brain is 70% made of fat. So there's actually some good studies right now showing that progesterone supplementation can really help with post-concussion syndrome because of what it's doing to help re-regulate that kind of neuroendocrine axis. But hormones are something that we often find go overlooked, especially in the athlete population, and especially with males. We'll find that they start aromatizing their testosterone. So then we can get them on things like DIM to help slow that down. Zinc can be really important for testosterone too. And people think of these hormones as mainly affecting sexual function, but they absolutely affect brain health and behavior. There's a lot of attention around testosterone and just hormone supplementation in general right now. And half of the ads talk about energy, and obviously they make some sort of nod towards sexual performance. But they also talk about feel clearer, better memory, better focus, things along those lines. And it has to do with testosterone, especially for men, is huge for our emotional regulation and sense of confidence. Men with low testosterone tend to have more anxiety. So by regulating that, that system to be more adequate, we can help with what are neuropsychiatric symptoms, essentially. So that's something that I find goes overlooked by a lot of other patients. My wife, we met in school, so we're both specialized chiropractors. She's a chiropractic internist, and that's one of her areas of specialty. She does a lot of women's health and work with fertility. So I get to piggyback off her all the time and kind of, ask her questions and to my own benefit.
You two are like a power team.
Yeah, I was going to say, it's a great, symbiotic relationship there.
Yeah. We try to keep each other straight, but there's definitely those nights where I come home and I'm like, okay, no doctor talk tonight.
Yes, boundaries are important. That's cool. And talk about innovative. I love learning new things. That's really interesting. I'm wondering, Dr. Z, what about strength training as tolerated for people who have a history of TBI or post-concussion syndrome in terms of supporting hormone balance? Are you promoting strength training in that way?
Yeah, absolutely. There's a lot of great physical therapists and trainers in the area that will sometimes co-treat with. But at the same time, I talk to patients a lot of times about the idea of your muscles are basically an endocrine organ. They have a huge influence over how your hormones are functioning in the body. And that's why movement is just such great medicine. But this is a great opportunity to talk about some of the other tools that we work with, because a lot of our patients can't exercise, and that muscle, they still need that muscle mass. It's, if anything, it's more important to someone who's in a wheelchair to maximize what their muscle, how healthy their muscles are. And that's where one of my favorite tools that we use in the office is whole body vibration. And it's one of those things that seems super simple. There's all sorts of different planes of movement and types of devices out there. We use a lot of classic whole body vibration, where a lot of the original studies were done, which is basically vertical displacement. So you're on this plate and it's just kind of buzzing. It's just moving up and down really quickly, between 10 and 60 times per second. And all that movement activates the righting reflex in the body and creates these muscle contractions. And those muscle contractions basically are an exercise mimetic. So for people that can't move, or even for people that can exercise, the vibration helps to enhance how our muscles and our joints are communicating with the brain. But again, those added muscle contractions really help to increase metabolic factors. There are some great studies on whole body vibration and changes to the gut microbiota too, like we're talking about today. They've shown an increase in short chain fatty acid producing beneficial bacteria, a decrease in the more harmful gram-negative bacteria. There have been some studies that show it actually can increase diversity too, although that's a little gray, because some of the studies show that the diversity actually went down because the good species went up so much. It kind of skews anyways, I'll let the researchers kind of parse that out. But we think about the microbiome, we think about probiotics and, maybe transabdominal laser and other tools kind of going right there to the source. Even mindfulness, most people know kind of breathing exercises, mindfulness, vagal nerve exercises can really help with the microbiome too. But these kind of tools, physical tools like whole body vibration, can dramatically change the composition of your gut lining, can change the way that your vagal nerve is kind of stimulating those cells to either be happy and proliferate or kind of go away and kind of kill themselves off. So vibration is something that we use with a ton of patients, and it's a great tool to help preserve muscle mass. I do a lot of speaking in front of people, and some of the places that will have me are like country clubs and retirement communities. So I end up talking to a lot of senior citizens about this too. And vibration is a great tool for them as well. You don't need access to a full gym and all sorts of crazy equipment. You can just take a resistance band, get on the vibration platform. You can just stand or sit on the vibration and get a lot of the benefits. But if you do 10 squats on vibration, it's like doing 20 squats on dry land. So it's this great enhancer for things. And then, for that population, a lot of them deal with osteoporosis and osteopenia and things like that. And there's some good studies on bone mineralization with whole body vibration too. So it really just getting shook up like that can be really beneficial for the gut microbiome, preserving muscle mass, and cognition. It literally enhances the prefrontal cortex and how it's signaling.
So you have one of these devices in office, but is this something that patients can purchase and like put in their home? Because I'm thinking of
That was my question too.
We're on the same, yep, same wavelength. So for people that are like working from home and maybe at a desk all day, or they're very sedentary for whatever reason, is this something that they can like weave into their day to day, or do they have to go to a clinic? Yeah,
I want to go for a treadmill or a what do you call it? Just the walking mat.
Yeah.
Right, exactly. Yeah, no, so absolutely. We have a lot of patients where we'll get vibration plates in the home. We have a larger one in the office, but we work with Vibe Plate a good deal. We have 3 different vibration platforms in the office that all do different things, but the Vibe Plate's the one we use the most.
Is that the brand?
Yeah, it's just VIBE Plate, Vibe Plate. And we have a promo code if anyone's interested on getting a discount through that. So, but
we should put it in the show notes.
Oh, perfect. I'll put that on there. With getting equipment in the home, again, we see so many people where, whether it's a severe TBI or stroke, they'll come through an immersive program and that's all well and good. But sometimes we'll have people where we can do distance work with them and we can talk to them about, you can order a vibration platform at home. You can order Resimax is another kind of more localized vibration stimulus. We can get equipment in their hands and then we can kind of walk them through what to do with it. We're obviously a little limited, working via Zoom. But yeah, equipment in the home, that's massive. My quick story, I've been talking to my parents about whole body vibration just for, want to keep their brains healthy. And my mom has had some bone mineralization, kind of osteoporosis is in my family. So I was like, you guys just got to buy a vibration platform. And we have a family group chat. And my mom sent a message in the family group chat that said, all right, your father and I bought a vibrator. And then put a video of my dad standing on the vibration platform. And luckily I didn't die of the heart attack that I had. But that's one of those things patients will say, what was I doing when I was on the vibrator earlier? And I'm always like, oh, the vibration platform? Yeah, that's what that's called.
Yeah. The official term, please.
Yeah. Oh my gosh, that's too funny.
But yeah, I absolutely recommend it as a wellness tool. Just like it basically, all the benefits of exercise you get from vibration.
Sounds like it's a non-negotiable. I feel like I don't know. I mean, that's at the top of my wish list now.
And going into kind of like the more lifestyle factors. So these are all things that we can kind of add into our daily life, but like, what are we doing on a day-to-day basis that's like destroying our brains that we're just completely unconscious of? I mean, I'm thinking like screen time, social media, dehydration, all these things, but what is top of line for you on things that we need to cut out?
Well, yeah, I mean, you definitely hit the nail on the head there, not to mention with technology usage, not to mention, the idea of like EMF sensitivity. We end up seeing a lot of patients with high sensitivity to EMFs. And then it becomes this idea of they get labeled with conversion disorder, like it's something that they're basically making up. It's all in their head. And then that does become a problem when you hyper focus on the problem, and it's for a reason, we're surrounded by it all the time. That kind of perpetuates the problem in a lot of ways and creates this hypervigilance. But we see a lot of patients for that. And we have a wonderful local nurse actually who started a business helping people to mitigate EMFs around the house. We had our office measured in different areas, so we know where to help people rest when, that is an issue. But things that people are doing day to day, I mean, movement is just so key. And I always explain during my talks, the way the technology has progressed, if you don't want to move, you really don't have to move. You can kind of sit on your lounge chair, you can order DoorDash, you can like stream to your TV without getting up. Like, it's really like you can just totally automate everything and not move. And all those little reps, all those little movements that we just click something on our phone as opposed to standing up and doing something, that's activity that we're missing out on, over the course of our lives. So park far away at the grocery store and just kind of take a nice little walk through the parking lot. Just the more movement, the better. Get a vibration platform at home. Talking about the microbiome, fermented foods are a great way to help preserve the brain too, because of this bidirectional relationship we've been talking about with the microbiome, and be bored. That's the other thing too, is the way that our society is kind of designed right now is to kind of maximize what everyone's capable of from a productivity standpoint. And then when you do have downtime, you can go on social media and see all the productive things other people are achieving, which just stresses you out sitting there. So boredom is one of those things that's thought of as negative, but ultimately boredom is what drives you to get up and do something. We just don't really have the chance to be bored right now, the way that our society is set up. So mindfulness, getting outside and kind of unplugging from the phone, like you had mentioned, not being on it constantly and feeling tied to it, can do a lot for, we're destroying our autonomic nervous systems. We're always kind of on call, or I need to answer my phone. I need to be ready if someone texts me. And that's basically creating this subtle level of anxiety for some of us, not so subtle. And very well documented at this point that autonomic imbalances changes to the way your brain is talking to your heart and your digestive organs. Not only is going to affect your psychiatry, but it's going to affect your longevity and your likelihood of cardiovascular disease. Stress is the big killer. And ultimately what we need is not all this fulfillment and these stress relief and like going on these massive retreats and things like that. That may be good for some people, but on a day-to-day basis, just finding ways to unplug and let your brain kind of do nothing can be really helpful. There's this group of nuclei in the brain called the default mode network that's highly implicated in a huge number of psychiatric disorders, learning and behavioral disorders. And basically, this is the part of the brain that's active when we're not engaged, we're not having a conversation, we're not actively reading something, we're just kind of being, just kind of being a human being and not a human doing for a couple of minutes a day. Maybe throw some breathing exercises out there, can be just one of the best day-to-day tips.
And not to mention the blue light. Sorry, Melissa, but that mental stress and the physical stress from the blue light and all of our devices, I think, it's tapping into all of those negative effects that you just mentioned.
I was going to say, I feel like just kind of how our lifestyles are, and just with our careers and everything going on, and we have so many distractions, and like you said, social media, it's like our brain is constantly stimulated all the time. It's like these dopamine receptors are just getting depleted, that it's almost like everyone talks about how difficult it is to just sit still and like meditate. It's, this big challenge for a lot of people. And I assume, everyone's running around with all these like crazy high cortisol levels, or maybe they're even at the point where they're not even producing cortisol anymore. Who knows? But what effects does that have on the brain? Is there a link between cortisol and brain inflammation or function?
Yeah, absolutely. So like you mentioned, in those kind of chronic depleted states, cortisol helps to activate, from kind of a global perspective, our cells to kind of mobilize and be more active from an energy perspective and start kind of burning that fuel. And like we established earlier, the brain is the most sensitive to fluctuations in that fuel. So changes to cortisol, changes to the autonomic nervous system, these things are massive. And sometimes I'll explain it to patients like you should have kind of the relaxation, the fight or flight parts of your brain should be kind of like a seesaw. There's times where they activate together, but for the most part, they're kind of just going back and forth, and, they're both there and hanging out and doing their job. So many people that come into our office, it's like one end of the seesaw is just totally on the ground. The other one has no way to generate any momentum. And that's where we have to use tools to kind of make that person able to unplug and do nothing. Because like you said, it's hard to do. We're kind of conditioned, and our brains become basically trained to think like, downtime or boredom is bad or negative, when ultimately it's restoring. One of the therapies that comes to mind we use in our office is hyperbaric oxygen therapy, which is fantastic from a metabolic perspective. Basically, with the increased atmospheric pressure inside the chamber, we're able to dissolve more oxygen in the blood, which then lends itself well to increasing the aerobic respiration, the energy production in our cells, can help to normalize cytokine signaling. For our brain patients, especially stroke patients, we can create neovascularization, or new blood vessels in the brain, which is hugely important for improving the function of different areas. But with hyperbaric oxygen therapy, so many of our patients come in and we kind of explain them the process. They're in this chamber. It lasts about an hour. you're kind of lying down and comfortable, we usually just recommend going to sleep. You can kind of listen to something if you want. And so many people, it's like I can predict the question is going to come, can I be on my phone? Like I'm a teacher and we're in school or something.
Yeah.
And luckily that gives me a chance to kind of say, well, if you want the maximum benefit, I would recommend just kind of, go to sleep, do some mindfulness exercises. If you want to listen to a podcast, that's better than jamming that blue light in your face. But just the idea of an hour without kind of scrolling, being on the phone, some sort of TV show or, some sort of form of entertainment, to a lot of the patients that come in is this like, you mean I have to go through that right now? So that's where it can really help, I think, not only from the actual hyperbaric oxygen therapy itself, but I think actually forcing these people to kind of unplug and, kind of be away from their phones and not watching something, not being as fully engaged as they typically are. I think that explains a lot of the benefits just as much as the technique, the technology of the machines.
How do you unplug, Dr. Z?
Well, that's kind of rare right now with my 16-month-old at home, but being with her is just nuts of what I try to make time for right now. My wife is a doctor as well and sees patients mostly from home, mostly telehealth. So basically I get home, my wife goes upstairs and starts working, and I kind of get my time. My daughter's name is Quinn, so that's my Quinn time. And that's one of my favorite things. But I live out in the country outside of Asheville too. So, just kind of sitting in my yard. I'm one of those guys that likes mowing the grass too, because you kind of look back and it's like, doesn't that look nice? But yeah, I haven't played hockey.
Meditative.
Huh?
Oh, I just said meditative. I'm sure, and the smell of fresh cut grass is wonderful.
Yeah, exactly. And luckily working, here at Apex, I have access to all these great tools, so I can come in and do hyperbaric or do things like that if I'm having a tough day. But yeah, no, good question, because it's like, I do need to find ways to unplug more. I need to take some of my own advice.
Yeah, we all do. I mean, and I think going out in nature, whether it's mowing or just listening to the birds, I think that's a really great way to unplug for so many of us. And just, getting out and walking, that's really important to me, to be in a neighborhood that has a good walking score, right?
Yeah.
And sidewalks. I was just talking to you guys about that before, Melissa and Jamie, but yeah.
It's just so crazy. Like sometimes with the nature of our lives, it's like some people don't even get outside every day, so
right.
It's almost like in today's society, you really have to make a strong effort too. But Dr. Z, this episode, I feel like we dived into so many different things. Like I'm going to have to go back and re-listen and rewatch and take some notes on some of the tips that, you threw in here for us today. But I know we're coming up on the hour. So before we close, I do like to end every episode with a really positive question. What does it mean to you to live a vibrant life?
I love that question. We talk to patients all the time about the frontal lobe of the brain, because it's very commonly damaged by different disorders or, head injuries. But the frontal lobe is the part of our brain where you can think of it like our human lobe, like our higher levels of executive function and processing that kind of separates us from most of the animal kingdom. Really comes down to how our prefrontal cortex in this area is firing and functioning. And then our temporal lobe, a little lower down in the brain, is responsible for a lot of our memory function. But that's also where our limbic system, a majority of our limbic system, is housed, which is our sense of emotions and our emotional output from the brain. I feel like, and I'm kind of stealing this from Dr. Mike Hall, but I always think of it like living in your prefrontal cortex, living in your more humanistic, higher thinking, executive functioning level of brain, where you're more in control and making decisions, as opposed to living in your temporal lobe, where you're kind of letting your whims and desires and comfort seeking sort of dominate your behavior. That's kind of how I think of it. And it's helpful for both myself and also kind of a model to help explain things to my patients of, how do you become master of your own brain?
How do you become master of your own life? Through your brain. I love that. I love the scientific approach.
That's awesome. Yeah.
And where can people find you if they want to connect with you, be a patient, learn from you?
Sure. So if anyone's interested in becoming a patient or kind of coordinating with us on that type of thing, apexbraincenters.com. There's a phone number on there and an email. You can reach out to our front desk. We do 15-minute complimentary calls with anyone before they step foot in the office, just so they know what to expect. And we are making sure everyone's a good fit for what we do. We do a lot of posting on Instagram. So if you're a Instagram person, check us out. It's at Apex Brain Centers. We do a lot of patient testimonial videos. I'll get in there and talk about, the microbiome or some kind of treatment that we do, something along those lines. And also our Facebook page as well. Those are kind of the best places to get us.
And what was your code again for the vibration plate?
Oh, it's all caps Better Brain.
Okay, awesome. We'll be sure to link your website, and we'll link that in the show notes for you guys if you want to check it out. But thank you so much, Dr. Z. You are such a wealth of knowledge. I love this episode. I love talking all things brain health because it's really applicable to everyone that's listening. And to everyone that tuned in today, thank you so much. We'll see you guys next week, and wishing you all vibrant health and wellness.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.